Well, hello everyone. This is Dr. Isabelle Amigues, your friendly rheumatologist from On a Bridge MD. This is another episode of On a Bridge MD. We have had quite a bit of time where we haven't done any interviews, and we're restarting those by popular demand. So today I am so excited to bring to you Dr. Tracy Paeschke. She's a cardiologist, board certified, and works primarily from Colorado Springs. But of course, she has also telehealth options. She's going to tell us all about it. But as you all know, or maybe you don't, but one of the research area that I had been interested in when I became a rheumatologist was cardiology, because there's a lot of association of cardiovascular issues with inflammatory arthritis, particularly with rheumatoid arthritis and psoriatic arthritis. And so I work very closely with cardiologists so that we can make sure that we prevent any bad outcome from a cardiac perspective in patients with rheumatologic disorders. And so, well, Dr. Paeschke, thank you so much for coming on the podcast. This is our first time, I'm sure not our last. Tell us maybe a little bit about you. And I think what I want you to tell us is, why did you become a cardiologist, and particularly a preventive cardiologist? Why the practice you have today?
Right. Well, thanks for having me. So, I've been a cardiologist for about 25 years, taking care, the usual cardiologist, right? Taking care of people when they had their heart attacks or their heart failure. After you do that for a long time, you realize that there's an opportunity before people have those events, those catastrophic events, where we can intervene and maybe prevent those events from occurring in the first place, right? And so I think that's why I pivoted more toward this. It's just an interest of mine. I think for multiple reasons, the healthcare system that we operate in doesn't always focus on prevention, and a lot of cardiovascular, it's estimated that 80 to 90% of cardiovascular disease is modifiable through lifestyle interventions. And certainly a lot of rheumatologic diseases are tied to lifestyle factors. So it's just an important piece that I think we've been missing in our healthcare system. And so it's important for us to help educate people about, it's an empowering message, right? That just because your dad had a heart attack or your brother had stents doesn't mean that you're destined to have that. There's a lot of things that you can do to improve your risk. And so that's how I got interested in it.
Okay, wonderful. Yeah, that makes sense. I think, so I kind of want to go directly into the, a little bit more in detail of what's going on with our patients with rheumatologic inflammatory arthritis, right? So, in my world of rheumatology, we think a lot of the issue is due to inflammation. So, for example, I was telling this to a patient recently. We know that patients with rheumatoid arthritis have inflammation of the heart, inflammation of the vessel. And it actually makes sense. It's just probably we were not able to look for this. So do you think that cardiovascular disease at this time are mostly due to an inflammatory process, and is sort of the lifestyle modification that you're mentioning, is that in order to decrease this inflammation?
Yes. So, there's been a lot of data. I think the original paper was like in 1999 that inflammation, atherosclerosis is an inflammatory disease, right? So that was sort of when people first started realizing that it's not just cholesterol plaque, right? I mean, cholesterol is important, but what makes vessels, some people's vessels get plaque and other people's vessels don't, right? And then what's going on inside that plaque? So so it's inflammation. So now the current thinking is that it's two parts. It's cholesterol and inflammation. There have been several trials out over the past 10 years or so that if we can decrease inflammatory markers, so decrease inflammation, if we can, there have been studies giving colchicine, to decrease inflammation, right? And that when we treat people with those inflammation fighting drugs, that we can improve their cardiovascular, lower their risk of cardiovascular events. But again, we don't have to go skip right to the drugs, right? So there are a lot of things in our daily life that we're doing that cause inflammation in the body, right? So eating a poor diet.
Dr. Paeschke, before we go there, because I definitely want us to go
Yep.
there, what we can do to prevent, I just want to make sure that so we are understanding this. So cardiovascular disease, and especially a myocardial infarction or heart attack, is from what you're saying and from the studies that you were mentioning, an inflammatory process and a cholesterol issue.
Right.
And so we'll talk hopefully about both, right? And so it's this association that causes issue of the heart of patient. Is that correct?
Yeah, not so much even the heart, but the vascular system, right? So the blood vessels. So
Yeah.
inflammation affects the blood vessels, and it's, some people call it sort of a chronic inflammatory vascular disease, right? So inflammation affects the cells, the endothelium, the lining of the blood vessels that allow cholesterol to pass through the cells. And then when the cholesterol gets in the endothelium, you get all these changes that occur. This plaque becomes filled with inflammatory cells, right? So like your body is reacting to the cholesterol and trying to fight off and wall off that cholesterol plaque. And in the process, sometimes those inflammatory cells make that plaque more unstable, right? And that's how we think, because there are different types of plaque, right? There's hard plaque that's calcified and stable, and that's what we pick up on a CT calcium score. And then there's this unstable soft plaque full of these inflammatory cells. And that's what we call vulnerable plaque or unstable plaque, soft plaque. So that you get all these inflammatory cells and this thin cap over the plaque. And I describe it like a volcano, right? You got all this going on and this thin cap, and that cap can rupture, and then it releases all those inflammatory cells into the bloodstream. And again, that causes a whole cascade of events, leads to acute things like a heart attack or a stroke.
So that's really, really interesting. And so that leads to what I want to ask you next before we talk about what can we do to treat and prevent that, right? Before that, I do want to just mention the fact that you did mention the colchicine. There's also there was also studies with methotrexate and anakinra, which are all three are rheumatologic drugs. And I agree with you. I think that those studies were all positive, and it did prevent cardiovascular bad outcome from a cardiovascular perspective. And yet we're not using them on a regular basis. Thank goodness, right? Because we have other things. But so before we go into what can be done, we don't hear a lot preventive cardiologists as work, right? And so if people were to go on your website, which is called Heart Health, Prevention and Wellness, right? And I love this because, but I want to and I want to make sure that people get what that means, right? Like, so I'm assuming that for people who have a strong family history of cardiovascular disease in their family, like uncle with MI, maybe their dad died at 45 or 50, or maybe even earlier. Maybe for people like that, it makes sense. But tell us what really, like, so you're talking about this volcano idea of things are brewing and then it's going off, and that's what's causing the myocardial infarction. That's what's causing the stroke, and those are terrible events, and we want to prevent that. what do you do as a cardiologist, as a preventive cardiologist? What is exactly what you do, other than explaining how to prevent that, because we're going to go there. But
Right.
what does that look like? What is the patient that comes to you, and who are the patients you would like to absorb so that we can prevent that?
Right. Well, heart disease is the number one killer of men and women in the world. So everybody needs to come see me, actually. They don't know that, but they do, right? And so I do several things. So I send people for advanced lipid panels and inflammatory markers. So in my practice, the standard lipid panel, it's a good starting point, but that's it. It's a starting point, right? So even the LDL that we get on the standard lipid panel, that's a calculated LDL concentration. It's not even measuring the LDL particles, right? So we know that there are things like ApoB, the little tail that comes off the lipoproteins. We can measure those directly. We know that there are things like LP little a that are, if your LP little a is elevated, it's associated with increased events. And that one tends to be genetic and run in families. So it's recommended. The European Society recommends that everyone get an LP little a checked once a year now. And I think the US guidelines are going to move to that as well. Or not once a year, once in their life. So I check those advanced lipids. I check things like myeloperoxidase, LDL particle size, CRP.
At what age do you start looking for this?
Well, I don't know if you saw that. People always ask me that, and I don't know. I think there was an article published a week or two ago that showed those two curves for aging. Did you see that? That there are two, how we tend to think of aging sort of as a linear process, right? Well, a study came out last week, I think it was. We have two huge aging curves. 44 is the first one, and the second one is 60. So that's when we see changes in not only like hair and skin and the external things, but also changes internally in our cells. So I would say, and we know that, chronic disease incidence is so great in the United States. Things like obesity and diabetes and high blood pressure, which are all risk factors for heart disease. So I would say in your 40s, early 40s.
All right. So so in your early 40s, so I think everyone that's listening to this podcast episode, and I would say, like, for me, I think I do a MAGA scan because of the treatment I've been on for my own history of my, like, I like to say, in the past cancer history. So I do this, but I would not have thought that 40s was enough, but so I think maybe everyone as a birthday gift for their 40th birthday should sure that they do a cardiology evaluation so that all of our lives are doing really, really well. Because I think one of the things that people don't necessarily realize, I think we are thinking of cardiovascular disease as like the myocardial infarction, heart attack. I think that people don't realize that the vast majority of people are going to absolutely be okay with it afterwards, but they are going to have a heart that's less and less functional. And so they cannot do all the things that they were used to do, such as, skiing, climbing. That's for Colorado people, right?
Yeah.
Mountain biking. And so I think it's just really, this prevention is really so important. And I'm so happy you're doing this. So at 40, early 40s, we're all making an appointment with you or with a preventive cardiologist. And then we do a lipid panel that's more advanced than the one that our primary care physician would do. What else do you recommend?
Right. So inflammatory markers, right? Because again, those signal that someone might have inflammation in the body. So CRP, myeloperoxidase, different markers. And then the other important piece that we haven't thought about is some sort of imaging. Okay. So, not like you're having chest pain and you go see the cardiologist and they do a stress test. I'm talking about some sort of imaging to look at your blood vessels in your heart. So we have the technology. Insurance doesn't pay for screening cardiology testing, and a lot of people don't know we have it or it's available, but it is. So there are different tests. One is the CT calcium score. So that's an easy test. You can get that anywhere really for around $100. We know that people with an elevated calcium score, that's associated with increased cardiovascular risk, right? And if your score is 0, your risk over the next 10 years or so is very low. So it helps us go beyond the cholesterol, beyond, right, to what you have. So more like, we do colonoscopy to look for polyps, to take out the polyps so it doesn't become cancer, right? Well, most heart attacks occur in people with normal cholesterol and only mild disease, right? So if we pick up that mild disease by some sort of imaging, we can intervene with aggressive lifestyle modification, sometimes medications, to get their risk way down so that mild plaque doesn't become unstable and rupture and cause their heart attack. So again, prevention, it's much easier to prevent disease than to treat it, right? So prevention is the key. The best imaging test is called a CCTA. So that's a CT scan of the coronary arteries. Gives us beautiful 3-dimensional pictures of the heart arteries. And we have what's called like Clearly, which is a software analysis of the plaque. So we can see inside your arteries, if you have plaque, where the plaque is, how bad is it, what kind of plaque is it? Is it soft plaque, hard plaque, mixed plaque? Because again, risk is different with each kind of plaque. So again, because we know, especially in women, risk calculators that we take out to determine people's risk of having a heart attack, yeah, they're not that good, right? So we need to sort of change our thinking on that and look at arteries, not just go by the cholesterol, but see what's going on in our arteries.
Wonderful. So I think from this first episode together, what we can gather is, and I'm just going to summarize this because it's really important, is preventive cardiology is much more efficient than curative or treating cardiology, in the sense of, if you have a volcano, we can prevent that volcano from getting out. So that's the beauty of what we can do in medicine. We can actually stop the volcano from starting and from erupting. So we can do that. We've also learned that there are 2 peaks in life, one of early 40s and another one early 60s. And that basically everyone should have an evaluation that is a lot more detailed than what is currently offered in the medical world, that's driven by insurance. And so you and I are out of the insurance system. So we will have a second episode where we're going to go a lot deeper into what we can do to help our cardiac health. In the meantime, I'm absolutely certain some people will be like, okay, I want to see Dr. Paeschke because I want to take care of my heart. Where can people find you? And then, of course, everyone listens to the next episode that with Dr. Paeschke, because we will go into what we can all do to prevent this.
Yeah. So people can find me, my website, www.hearthealth.care. I'm on Instagram and Facebook, and
is it heart as well? Is it
yeah,
heart health?
Heart Health, yeah. And you can find the links on my website. And I have a YouTube channel where I post some videos about, just information for people. I have an ebook on understanding and managing high blood pressure. People can download that from my website. So again, trying to educate people about their health, because the things they do to help their heart are good for everything else too, right?
That's so
Yeah. So that's what I'm trying to do.
wonderful. So everyone listen and go to the website, watch all the YouTube videos if you want to learn more. We will also have Dr. Paeschke come in and do a take two, more driven on what we can do to prevent this inflammatory cardiovascular condition that is atherosclerosis and coronary artery disease. In the meantime, thank you so much, Dr. Paeschke, for coming here, and I'm so excited for the next time you're here.
Thank you.